The eyes, the windows to the soul, are the place where every change of time is recorded. When we enter middle age, every glance, every moment becomes more precious than ever. It is the time when the eyes not only simply help us perceive the world, but also reflect our health, lifestyle, and the love we have for ourselves. The journey of eye care in middle age, therefore, is not only about preserving vision, but also about cherishing every minute, every simple thing in life. As we age, our bodies begin to undergo changes that we sometimes do not immediately notice. The eyes are no exception. From the age of 40 onwards, most people start to notice small but clear signs. Difficulty reading books up close, a feeling of dryness or grittiness in the eyes, sensitivity to bright light, or moments when night vision becomes blurrier. This is presbyopia, an inevitable part of the aging process. The lens in the eye gradually becomes less flexible, making it difficult to adjust focus when looking at close objects. The text on phone screens or small book pages seems to have to be held a little farther away to see clearly, the first signal of middle age knocking on the eyes. Not only in the elderly, the phenomenon of dry eyes also appears more frequently at this age. The tear glands no longer produce enough tears, or the quality of the tears is not as before, causing the eyes to often feel uncomfortable, itchy, red, or even continuously watery. Especially for those who frequently work with computers or live in air-conditioned environments, this condition becomes even more common. At the same time, glaring light also becomes a silent enemy. Driving at night under headlights or facing harsh sunlight outdoors, the eyes become more sensitive, easily dazzled, and difficult to adjust. Night vision deteriorates, and the ability to distinguish colors, especially shades of blue and green, is no longer as it used to be. But these changes do not stop at inconvenience. In middle age, the risk of serious eye diseases also increases. The first to mention is cataracts, a condition that causes the lens to gradually become cloudy, making all images blurry and losing their original sharpness. If left untreated, cataracts can lead to complete vision loss. Another danger is glaucoma, also known as the silent thief of sight. This disease rarely causes obvious symptoms in its early stages. It is only when the optic nerve is severely damaged that the patient notices vision loss, but by then, any intervention is already too late. It is impossible not to mention age-related macular degeneration, a disease that directly affects the ability to see fine details, read, and recognize faces. When the macula is damaged, looking at the center of the visual field becomes difficult, with blurred spots or distorted images appearing. For those with diabetes, the risk of developing diabetic retinopathy also increases. The small blood vessels in the retina are easily damaged, leaking blood or fluid, causing blurry spots, and can even lead to vision loss if blood sugar is not well controlled. Another emergency condition is retinal detachment. When the retina separates from the supporting tissues, the patient may see many floating black spots, unusual flashes of light, or a dark curtain appearing at the edge of the visual field. This is a red alert signal requiring immediate medical intervention. So how can we protect our eyes from those risks? The answer lies in being proactive, persistent, and loving yourself every day. First, make regular eye exams an indispensable part of your healthcare routine. Even if your eyes still see clearly, you should have a checkup at least once every 1 to 2 years, or more frequently if you have risk factors such as diabetes or a family history of eye diseases. A comprehensive eye exam not only helps you adjust your glasses appropriately, but more importantly, also allows early detection of serious conditions, preventing irreversible vision loss. Nutrition also plays a decisive role in eye health. Foods rich in vitamins A, C, E, zinc, omega-3, lutein, and zeaxanthin are natural remedies that help protect the retina, reduce the risk of macular degeneration, cataracts, and dry eyes. A diverse meal with dark green vegetables, salmon, carrots, eggs, fresh fruits, and nuts is not only good for the eyes but also for your entire body. In addition, don't forget to protect your eyes from environmental impacts. When going outside, Wear high-quality sunglasses that provide maximum UVA and UVB protection. If your work or habits require you to spend a lot of time in front of computer or phone screens, consider using blue light blocking glasses. And apply the 20-20-20 rule. Every 20 minutes of work, look at something 6 meters away for 20 seconds to allow your eyes to relax and rest. A healthy lifestyle is a solid foundation for maintaining bright and healthy eyes. Say no to smoking, the culprit that increases the risk of cataracts, macular degeneration, and optic nerve damage. Effectively control chronic diseases such as diabetes, high blood pressure, and high cholesterol to protect the small blood vessels in the eyes. Maintaining a reasonable weight, exercising regularly, and getting enough sleep also help improve blood circulation, reduce inflammation, and support the daily recovery and regeneration process of the eyes. In daily life, pay attention to keeping your eyes moisturized. If you have dry eyes, do not hesitate to use preservative-free artificial tears as prescribed by your doctor. Drinking enough water and installing a humidifier in the room, especially in winter or when using air conditioning, will help prevent your eyes from becoming dry and irritated. Don't forget to keep your eyes clean whenever you touch them. Avoid rubbing your eyes vigorously, and you can gently massage the area around your eyes to improve blood circulation. Simple exercises like moving the eyes in different directions or alternating between looking near and far are also very useful for maintaining eye muscle flexibility. When reading or working, make sure there is enough light to avoid eye strain. If you use contact lenses, strictly follow the hygiene instructions and usage time. Wearing lenses for too long or improper cleaning can lead to serious eye infections, even causing permanent vision damage. In the journey of eye care, be sure to avoid common misconceptions. Many people think that as long as their vision is clear, their eyes are healthy, or that wearing glasses will weaken their eyes. In reality, glasses only help correct vision and do not harm the eyes. On the contrary, not wearing glasses when needed can cause the eyes to overwork, leading to eye strain and faster vision deterioration. Another misconception is that eating carrots alone is enough for bright and healthy eyes. In fact, the eyes need a variety of nutrients from a diverse diet, not just vitamin A. In particular, be alert to serious warning signs: sudden loss of vision, seeing many black spots or unusual flashes of light, the appearance of a dark curtain at the edge of the visual field, severe eye pain, red eyes, sudden blurred vision, double vision, distorted images, or any eye injury. If you experience these symptoms, see an ophthalmologist immediately, as delays can lead to irreversible consequences. Taking care of your eyes in middle age is not a very difficult task, but it requires persistence and proactiveness. Don't wait until your vision deteriorates, when everything becomes blurry, when the letters are no longer clear, to start thinking about protecting your eyes. Take action today. Make good habits a part of your life. Every morning, when you open your eyes to welcome the dawn, remember that your eyes are a priceless gift that life has given you. Cherish, care for, and nurture those eyes in the most scientific and loving way, so that in the years to come, you can confidently enjoy every color, every smile, every moment of life, with bright, sharp, and vibrant vision. Thank you for taking the time to listen to these shares. I wish you always keep your eyes bright and healthy, so that each new day is a journey full of vibrant colors, filled with joy and happiness. See you again in the next sharing sessions, with lots of useful information for your health and that of your loved ones.